adrenoceptor blocking agents. Now actions, these are the beta adrenoceptor blockers. When the beta blocker are activated in kidneys, beta 1 receptors, when they are blocked, what will happen? Renin release will be reduced, angiotensin 2 will be reduced, aldosterone will be reduced, and sodium water retention will be reduced, which will in turn reduce the blood volume and decrease in blood cardiac output and blood pressure. Also beta 1 on heart, when they are blocked, cardiac output will be decreased, blood pressure will be decreased. Angiotensin 2 if blocked will also reduce the peripheral resistance and decrease in blood pressure. Now the therapeutic uses, they are used in hypertensive patients with concomitant heart disease such as supraventricular tachyarrhythmia, atrial fibrillation, previous MI, stable ischemic heart disease, chronic heart failure. Pharmacokinetics, they are orally active and highly variable first pass metabolism. Only beta blockers will take several weeks to develop their full effects. Esmolol, metoprolol and propranolol are available in IV formulations as well. Adverse effects: hypotension, as they block, you have seen the whole mechanism, bradycardia, fatigue, insomnia, sexual dysfunction. Drug withdrawal, abrupt withdrawal, you can see severe hypertension, angina, MI, in even sudden death with patient in ischemic heart disease. So they must be tapered few weeks. The next is ACE inhibitors. Captopril, enalapril, lisinopril, they are all recommended as first line treatment for hypertension patients, including coronary disease, risk of diabetes, stroke, heart failure, MI, or chronic kidney disease. What is the action for ACE in these inhibitors? And angiotensinogen get converted into angiotensin 1 by renin. Renin inhibitors work here. Now angiotensin 1 gets converted to angiotensin 2 by the help of ACE, angiotensin then converting enzyme. ACE inhibitors will act at this phase. They will block this enzyme and block the conversion. Then angiotensinogen goes to aldosterone production, goes to the receptor. They bind to the receptor, angiotensin receptors, and they produce decreased sympathetic nervous system output of vascular smooth muscle, vasodilation is increased, and sodium water retention is decreased, and therefore blood pressure is decreased. The angiotensin receptor blockers will act here. When the angiotensin is going to act on the receptors, they will come and block this phase. Aldosterone receptor antagonist, aldosterone receptor will act on the aldosterone receptors and on this phase. So these are the effects of different types of drugs: renin inhibitors, ACE inhibitors, ARBs, aldosterone receptor antagonist. Now therapeutic uses. ACE, a beneficial effect on renal function may result from decreasing intraglomerular pressures. ACE inhibitors are a standard in the care of a patient following MI and first line agents in the treatment of patient with systolic dysfunction. Chronic treatment with ACE will achieve sustained BP reduction, regression of left ventricular hypertrophy, prevention of ventricular remodeling after a MI. ACE inhibitors are the first line treatment for heart failure, hypertensive patient with chronic kidney disease, and patient at increased risk of cardiac artery disease, coronary artery disease. They are pharmacokinetic, orally available, and go hepatic metabolism, and as they are not primarily eliminated through kidneys, so at dose adjustment is not required in renal impairment patients. Adverse effects: cough. Dry cough is the most common adverse effect seen with the patients, and the mechanism is Due to increased levels of bradykinin and substance P in the pulmonary tree, the patient experiences cough. Cough resolves within few days of discontinuation. Angioedema is a rare but potentially life-threatening reaction. Potassium levels must be monitored, and potassium supplements, potassium sparing diuretics should be used with caution due to the risk of hyperkalemia, as the retention is reduced. So serum creatinine levels should be also monitored in the patient. ACE inhibitors can induce fetal malformations and should not be used by pregnant women. Dry cough, hyperkalemia, skin rash, hypotension and altered taste. Now next comes